Honey, that wonderfully sweet, gooey, insect-produced substance, is far more interesting than its use on peanut butter and honey sandwiches. Medically, it's one of those everyday things that can both severely harm or significantly help someone depending on the situation. This is because honey has some rather unusual properties. Honey is largely made up of three things: two types of sugar, glucose and fructose, and water. It is a supersaturated liquid, meaning that the liquid has more sugar than can normally be dissolved in water. The sugar level is so high, in fact, that honey will actively steal water from its surroundings, whether that is water vapor in the air or from any bacteria coming into contact with it. In effect, honey is a desert for bacteria. There are a few types of bacteria that can survive in honey, however. The most serious of them is known as Clostridium botulinum. Clostridium botulinum avoids the water theft problem by forming inactive spores. The spores don't have much water and don't let what water they have escape. This bacteria is what can make honey dangerous. Clostridium botulinum is in the bacterial family known as Clostridia, most of which are not particularly friendly to humans. Botulinum's most well-known siblings are tetani, perfringens, and difficile. Clostridia have two main characteristics: the ability to form spores and the ability to produce toxins. C. tetani produces tetanospasmin, which causes muscle spasms. If you get infected, it causes tetanus, more commonly known as lockjaw. C. perfringens produces an alpha toxin, which results in gas gangrene, which honestly is just as bad as it sounds. The toxin causes the breakdown of tissues and the production of large amounts of gas. It is both incredibly painful and lethal. C. difficile produces an enterotoxin and a cytotoxin, which combined cause pseudomembranous colitis, which in some cases leads to the rather lethal toxic megacolon. Amazingly, none of these toxins are as lethal as C. botulinum's. You see, C. botulinum produces botulinum toxin, which causes paralysis. You may know it as Botox. The doses given to paralyze the facial muscles of the vein is extremely tiny, as it is the most acutely toxic substance known to man. The lethal dose for half of those exposed is 1 nanogram per kilogram. This means that 350 grams of botulinum toxin, evenly distributed, would be sufficient to kill approximately half of the world's human population. And yet, C. botulinum spores are normally present in honey. For adults, our normal gut bacteria prevent the spores from germinating once they've been eaten, so they don't cause any problems. Babies under 1 year of age, however, have immature gastrointestinal tracts with relatively new gut bacteria, so the spores will occasionally germinate. This results in the unfortunate floppy baby syndrome of infant botulism. These children will often need to be put on ventilators for up to 6 months until their diaphragm muscles recover enough from the toxin to allow spontaneous breathing again. Oddly, the same property of honey that makes it friendly to botulinum spores also makes it effective for other antibacterial purposes. Honey also slowly produces hydrogen peroxide and other antimicrobial substances. There is good evidence to suggest that honey works as a good dressing for minor burns and abrasions after it has been irradiated to kill the spores. Also, it seems to be effective for suppressing coughs in children over 1 year of age. So there you have it. Honey. A sweet treat that contains dangerous bacterial spores but can heal wounds and stop coughs.